Safe sleeping for baby. All parents will need to decide how and where to place their baby to sleep. The choices can be overwhelming, especially if you are first-time parents. The possibility of SIDS, sudden infant death syndrome, or cot death terrifies all parents. Every year, 4,000 babies die in the US whilst they are sleeping, and 90% of them are less than 6 months of age. For years, we have been advised to put babies to sleep in their own cots and not to co-sleep. However, studies show that more than half of parents do bed share. In this video, we will discuss the essential steps needed to ensure safe sleeping and how to minimise the risk of SIDS. Many parents will bed share, so we will explain the evidence behind co-sleeping and how to do so safely. Hi, I'm Dr. Gina, and over my 15 years career as a paediatrician, I have managed thousands of families navigate those tricky first few years. As a paediatrician, how to ensure safe sleeping is a common issue parents come to seek advice about.
Hi, I'm Elise. I'm the founder of PramFox, a baby gear boutique here in Singapore. I'm an engineer and a mum of 3 boys, all under 6. And we're going to talk about how we can actually take these recommendations and turn them into practice for you.
Recommendations from infant sleep organisations advise the following. So firstly, place baby on their back to sleep in a cot in the same room as you. Now we all breathe in oxygen and we breathe out carbon dioxide. When babies sleep on their front, the carbon dioxide they breathe out builds up around their face instead of breathing in air with lots of oxygen. They are just rebreathing in the air that they have breathed out, which will have very high levels of carbon dioxide. This air has less oxygen, which can cause baby to have low oxygen levels in their blood. Some babies will wake up and move their head and will be able to get plenty of oxygen. However, some babies will not wake up, and these babies can potentially die. Babies who are sleeping on their back are less likely to have this problem. The safest place to put them to sleep is in a cot or a bedside crib in the same room as you for the first 6 months of life. So the second one is don't let your baby's head or face become covered. This greatly increases the risk of them suffocating.
To prevent baby from wriggling down under the covers, place baby's feet at the foot of the cot so they can't wriggle down. Arrange the covers so they only come as high as baby's shoulders. Securely tuck the sheet in so they can't come loose and inadvertently suffocate baby. Don't use any loose bedding.
In fact, I don't recommend babies use top sheets at all. It's really for older kids to use top sheets. So there's sleeping bags, like baby grows, that kind of thing, that kids is specifically introduced for safety reasons. So you can still keep the kids warm, they can still feel snugly, even especially in Singapore if warmth is not the goal. So if you're not using aircon at night and you're looking for a sleeping bag to use at night, 0.5 TOG would be the one if you're not using aircon. Do you know what it would be if you are using aircon? I know I've not used aircon.
So if you're using aircon, try and keep the room at about 25 to 26 degrees.
And do you know what thickness?
0.5 TOG or 1 TOG.
Yeah, okay.
Yeah.
Okay,
so it's not very much at all, especially in Singapore.
Yeah, and then having a fitted sheet that goes around the bottom of the cot is really important. So making sure that when you're buying a cot, that if you aren't getting the cot sheets that are made by the cot manufacturer, then at least you're doing your homework and checking the dimensions of the mattress.
So thirdly, no soft toys or loose bedding. So any loose bedding, any soft toys, pillows, nests, wedges, baby bumpers, all of those things, they can suffocate baby. So you do need to keep the cots completely empty of all of these things. And something that I see a lot is, people do want to put baby bumpers into cots, don't they? Because they're worried that the bars are so harsh for them. But it's not safe. It takes very little for something to obstruct them. And as a paediatrician, this is something that I've seen time and time again in my career. And then with the cots, there are specific recommendations for how wide the bars and things need to be, aren't there? So it does need to be, a cot that has been endorsed by the safety agency or something like that. Is that right?
So there are definitely unsafe cots and there are safe cots, and cots that are being produced and sold recently, so long as they're legal. So if we are talking, and anyone could be watching, but if we are talking Singapore specifically, cots need to meet either the European or the American standard, and they're both really high. And so if you're buying a new cot, that's great. If you're using like a second-hand cot or like a family heirloom cot, This is where that cot either like might not have been made to safety standards, or at least they've been outdated. So a really common example of that is the drop side cots, where you can like bring it down a little bit to make it easier for you to lift the baby out. They're no longer like allowed under any international standard, but a hand-me-down cot could very well have a drop side. So there's some things that you need to be aware of.
And people do have, you know, pre-loved cots, don't they? So that might not be something that they're thinking about. So that's a really important point.
Yeah, so there has been a bit of a trend toward mesh-sided or fabric-sided cots lately, and it's sort of directly around this. So if you're using a wooden slat cot and you're not using cot bumpers anymore, then for parents who are like particularly concerned about having like a super comfortable if you're particularly concerned about that, that's what might drive you toward like a mesh-sided or a fabric-sided cot. So you're still getting the ventilation, but you don't have to worry about the baby like rolling up against the wooden slats.
And they're completely safe to use, aren't they?
Yeah, again, so long as they're adhering to the international standards.
So this actually brings us back to our next point that we've already mentioned, mattresses. So mattresses, they do need to be firm, they do need to be flat, they need to be well fitted. And going back to the cots being pre-loved, it is really important to make sure that even if you're reusing a cot, you do get a new mattress for each baby. Would you agree with that?
Yeah, there's huge hygiene benefits to doing that. Like, you know, especially in Singapore with the humidity, there can be mold issues if it's been in storage for a while. It's really good form to get a new mattress for each baby. And with an older cot, it can be really hard to find the right size mattress. So if you can put 2 fingers down the side of the cot, between the cot and the mattress, then that's a sign that the baby could get trapped between the like in the gap, and it's not going to work. You also want to make sure that the mattress is firm enough for newborns. So if the baby does like somehow roll onto their stomach, you don't want them to be like sinking into the mattress.
And for their face to become compressed against it. So then it needs to be very flat so that there's still plenty of ventilation.
So some brands actually have like a dual-sided mattress. So like when you put it in the baby's bed, it is a side facing up for newborns, and that's a lot firmer. And then for older babies, you can imagine like once they get a little bit heavy, they're not so much in a milk coma anymore, and they want to be in like a slightly more comfortable and squishy mattress, then you can actually flip it over to the B side, and the older babies can sleep on the other side of the mattress. Typically anyway, if you are using like a little cradle or a bedside crib, I think we'll talk about that a bit later in the co-sleeping, then like those mattresses are kind of like fit for purpose for that age group, and then when you can move into a larger crib, you might go for a softer mattress right from the start.
So another thing to mention is that you should never sleep with your baby on a sofa or armchair. It's so easily done, isn't it? Especially in those first few months of sleep deprivation. You know, you're sitting there with baby, you've just fed them, and then it's so easy for baby to fall asleep and for you to fall asleep, but it really does increase the risk of sudden infant death syndrome. It actually increases the risk by 50. So it's really important if you are moving your baby and you are feeding in a chair or sofa, as soon as you finish the feed, then you do put baby back in their safe sleeping place.
This can be one of the benefits of having like a little portable bassinet or a Moses basket. Like quite a few of the bedside cribs have like the bassinet part can lift off and you can move it into another part of your unit or your house. And so a lot of people often will come in thinking, well, I just want one big crib and sure it can fit in like this part of the bedroom and that's just where the baby's going to sleep the whole time. But you're right. Like those first 3 to 4 months, you're in survival mode.
Yeah.
And so if you are feeding in the living room or watching TV or something like that, then being able to bring the Moses basket out and put it right next to you on the floor, and once you finish feeding, the baby can just go straight into it. They can be like really tangible benefits to one of those solutions.
And you're right, as moms, we both know that, your baby will not be sleeping in the bedroom at all times. When they're having naps and things like that, you may be in another room, you might be getting on with chores, and then you can put baby in the bassinet and get on with it and still monitor the baby.
Yeah, there are huge benefits to having, I like to call it like super flexible sleep solutions. So you want something that you can easily change bedrooms. You don't have to like dismantle a cot to drag it from one room to another. Not just because you would never do that just for a half-hour nap somewhere, but also you know, sleep, whatever is working for you is not necessarily going to work for you forever, and you're going to end up playing like musical bedrooms every couple of weeks. And so being able to test out what is working for you at that specific point in time.
And if you're not flexible, or you don't think about the fact that baby may be sleeping in another room, that's when you're more likely to fall asleep in a dangerous position.
Yeah, or bed share, or sleep with the baby carrier attached to you.
It happens. So number 6, do not let your baby get too hot or too cold. Now, babies cannot regulate their temperature very well, and therefore they are at risk of overheating. They can overheat if they have too much bedding or clothing, and or because the room is hot. So you do need to regularly check your baby to make sure that they aren't getting too hot. Babies generally lose excess heat from their heads, so it's really important that you don't have anything covering their head. So even if it's, you know, winter time, do not put any hats on baby. They don't need a hat when they're sleeping. If they're not able to get rid of that excess heat, they are at risk of overheating, and that does put them at a higher risk of sudden infant death syndrome. It is important to find out what the best room temperature is, and it depends where you live in the world, and also if you have summer or winter. Here in Singapore, it's around 25 to 26 degrees, but in the UK, actually it's 17 or 18 degrees. So find out what the recommendations are before baby is born, and make sure that you're kind of sticking to those safe temperatures. So bed sharing or co-sleeping. In many cultures, it is the accepted norm to co-sleep. Babies instinctively do want to be close to their parents, and it does provide them with that warmth and safety that they need. Babies also frequently wake up overnight for feed, so parents may choose to co-sleep or may fall asleep with baby still in the bed. There are many advantages to co-sleeping. Studies show that mums are more likely to constantly touch and monitor their baby if they are next to them, so they're more likely to pick up on them being unwell or if there's something wrong. It also does enable baby to fall back to sleep quite quickly after a feed, and there's less disruption to them when they're feeding. Studies have found that co-sleeping itself, if done safely, does not in fact increase the overall risk of SIDS, but certain behaviours, if you are co-sleeping, do increase the risk. Therefore, if you follow the recommended safe sleeping advice, then co-sleeping actually can be done safely. So the recommendations are: place baby on their back to sleep. We've already discussed this. Again, keeping any pillows, any blankets or any other items away from their sleeping space. If you've got other children and you've got other pets, you shouldn't have them in the bed either, because children and pets can sleep really heavily, and if they roll over onto baby, then again that can be a suffocation risk as well. And you absolutely should not co-sleep if you have done any of the following. So if you've been drinking, if you're a smoker, or if you've been taking any drugs that's going to make you sleep more heavily, then you should definitely not be co-sleeping with baby. We also know that certain babies are at an increased risk of cot death if they are co-sleeping, and for these babies, a cot or a next to me crib is much safer for them. And those are babies that have been born premature, so if they're born before 37 weeks, or if they have a low birth weight, so if they're less than 2.5 kilos or 5.5 pounds when they were born.
So the benefits that you're talking about for co-sleeping, they can be addressed with a bedside crib. So a bedside crib is what it sounds like. It's a cot that is quite small and it goes beside your bed, but it actually straps, like the base of the cot actually straps onto the base of your bed. So there is, done correctly, there's no risk of, an increasing gap between the cot and your mattress that the baby could get trapped in or could fall down. One of the key features of the co-sleeping, what used to be called co-sleepers, but now they're calling them bedside cribs, are that the baby is like genuinely on a completely separate and lower sleep surface. So a lot of people will say, oh, well, actually I tried that bedside crib, but it doesn't have the exact same height as my mattress. That's good.
Yeah.
Like that's actually how it should be. So the co-sleeper or the bedside crib mattress should be at a lower sleep surface than your mattress, so the baby can't accidentally roll into your bed. The nice thing about those bedside cribs is they'll often have multiple modes. So if the co-sleeping stops working for you really well for a while, they can be a standalone bassinet. Some of them have like a cradle mode. Some of them have like a slight incline for refluxy and colicky babies. And like having those options and the functionality is really important. I remember we had a co-sleeper with number one, and he was a little truffle pig. And I'm a really light sleeper, so I ended up sleeping in the living room while my husband laid in the bed with and had the co-sleeper attached to the bed because he could manage it, but I couldn't.
And that point about having an incline for refluxy colicky babies is such an important one, because we do see so many babies that do have reflux, they do have colic, and actually being on a bit of an incline can help. And you can't do that if you're there in your actual bed, but you can achieve that incline if they're in a next to me crib, or if they're in their own cot. So that's another advantage for sure.
Yeah, and having one where it's actually a design feature and they've checked the angle and it's certified, it has those international standards based on this exact feature, is a better option than like jerry-rigging
Absolutely,
your own incline.
yeah, trying to get that incline yourself. The number of deaths from sudden infant death syndrome are decreasing each year as people become more aware of safe sleeping. Co-sleeping has always been a bit of a polarising topic, but we know that many parents do share a bed with their baby. So by following evidence-based recommendations, you can ensure that your baby is as safe as they can be, allowing a better night's rest for your baby and for you. And really the most important thing is making sure you've done your homework and you've got all the right equipment to help you achieve that.
Yeah, because as we know, winging it is what's usually causing a lot of the trouble.
And there is so much advice out there, and sometimes that advice is not always so helpful. So it really is good to go to someone who is knowledgeable about all of the different products and really taking that time to do your homework and making sure that you've got everything set up before baby comes to really minimise the risk.
Yeah, I mean, like it's really hard to identify who knows what, but I mean, I think a clear sign is like if you walk into a baby store and they have cot bouncers on all of their cribs and they have like bolsters and lots of pillows and whatnot in the crib, then like that's an interesting sign that they've decided to set up their newborn displays in that way.
Yeah, so it's kind of products over safety, isn't it? You want someone who really knows what's going to be safe for your baby.
Yeah.
Thank you so much for having a chat with me today.
Yeah, my pleasure, Gina.
We'll see you next week.